Good greetings to KINE 1304 students. This is Coach Flores. I will be summarizing 3.1. Learning Objective 1, describe the problem of sleep deprivation in the United States, including the unique challenges of sleep deprivation on campus. Okay, sleep deprivation, basically we're talking about losing sleep because of course, stress and external problems that we have around us. Okay, nearly every night we leave our waking world and slide into serious sleep stages punctured by changes in heart rate, respiration rate, blood pressure, and body process. In other words, basically at night, your heart rate decreases and your bodily functions may also decrease. Some may increase, but different things happen to you when you go to sleep. Okay. Our economic loss, $411 billion, is the estimated economic loss from high levels of sleep deprivation. Sleep deprivation is a condition that occurs when sleep is insufficient for a given age. What group are the most sleep deprived in the United States? Um, Individuals in states as Kentucky and Hawaii and some regions of the United States report being the most sleep deprived. Okay. In contrast, individuals from Oregon, Washington, Colorado, and other northern plain states have the lowest numbers of sleep deprived individuals. So depending on the area, okay, that's where we're pretty much looking at. Okay, age group, the percentages of sleep deprivation between 18 and 24, 32%, 25 to 34, 37.9, 35 to 44, 38.3, 45 to 54, 39.0, 55 to 64, it's 35.6. Okay, and this is for the Center of Disease Control, sleep prevention. Okay, for most of us, sleeping isn't a high priority. When asked to choose which five things were the most important, 35% of respondents say nutrition, 27% said work, hobbies, 17%, 10% said sleep, and 9% said their social life. So um, this chapter will talk about many reasons why people don't sleep adequately. Okay, and it can be many things as exercise, lack of exercise, or even what they eat. Somnolence is a lack of mental alertness that can affect daily performance. Okay, so many people tend to lag in the morning because they're not morning people. They wake up and they're very sleepy and they might get late to work and they feel real groggy, but it's a lack of mental alertness, and that's called somnolence. While falling asleep in class or studying for an exam have serious implications, one of the greatest potential risks for drowsiness is when a tired individual gets behind the wheel. So, if you are not sleeping right and you not want to drive long distance, chances are there's a slight chance that you might sleep while you're driving, especially when you take medication as well. Drowsy driving, sleeper statistics, please make sure that you're aware of this. Approximately 1.2% of American crashes are due to drowsy driving. So it's very important that you get your adequate sleep and not make sure that you drive with inadequate sleep, because research says that there are uh, chances of you crashing. So we need to be careful with stuff like that. Okay. Sleeplessness on campus, tired and dragged out students. Many students here, whether it's college or traditional high school, seem to be particularly vulnerable to sleep. In a recent survey, American College Health Association, 10% of students reported getting enough sleep, which is about 90% of students that do not get enough sleep. Okay, so these are statistics. This covers statistics about sleeping and deprivation in colleges. 30% of college students report sleep difficulties have traumatic difficulty to handle in the past 12 months. Okay, that means that they have traumatic or difficult to handle. That means that something happened where they couldn't sleep, or it's just too tough to handle. Maybe they got into an accident. Maybe it's just too stressful at work, and it's just maybe too traumatizing. 20% of the U.S. population suffers from a condition known as extreme daytime sleepiness or excessive sleepiness. This is a major compulsion of sleep, often when sedentary, along with persistent sluggish and fatigue that cause individuals to nod off at opportune times. So if you lead a sedentary lifestyle, which means that you're very couch potato-like, or you're very just laying down a lot, or just very inactive, um, your sleep may actually, catch up with you as well. Okay. Why so sleep deprived? Work, shift work, some truckers, long haul driving, drugs and medication. A lot of drugs have the side effect of sleepiness and drowsiness. Okay, excessive pain can keep a person tossing and turning at night. Okay, and that could be anything from bladder to glutes, stomach problems, and so forth. Sleeping habits. If you have a job that has different hours, that could be a factor as well. Gender: women have twice the sleep difficulties of men, believed to cause by hormone imbalances, pregnancy, menopause, and psychological issues such as anxiety and depression. Sleep disorders, okay? Studies point out to be sleep apnea and restless leg syndrome, major factors for sleepiness, and those are causes for to talk to a doctor to see what can be done for that. 17 to 23 is a major risk, is an age where males at higher risk for drowsiness driving, okay? So please be aware of that, okay? And the book continues with some some tech and health, weird and tired technologies told to our sleep, and it just basically suggests other alternatives to sleep better. Okay, and that's chapter 3.1.